Hi everyone, just gonna take a couple minutes to go over primary and secondary, how to prime it, how to back prime your secondary, and how to switch out your bags when you need to. So I just want to make sure that you have all your supplies available. I have my primary bag, I have a couple of secondary fluids here, which your antibiotics will often come in various types of bags. Sometimes they won't be in a bag at all, they'll just have the extension with the antibiotic attached to it. But we'll get to go over those as we start practicing next semester in our clinical settings. But I just wanted to show that secondaries can often look very different. So you have to really make sure that you're knowing what volume it should come in and what it might look like in that particular bag. I also have my primary and secondary tubing. So my primary tubing looks like this, and on the front it just says a Clearlink Flow solution set. And on this one, it has often, your secondary will always have this little extension on here to use for your primary, which I'll show you in a minute. But that's how you can often tell your secondary, plus the fact that it says secondary medication set. So, and they're sometimes can get mixed up in the med room, so just make sure that you look at it and have the right one. So I have my primary bag here, and I have this little blue toggle piece on here. Now once you remove that piece, you're still going to be fine. Fluid is not going to come out until you take your tubing and insert it into there, and then there's the little seal that it will break there. After that time, then it's open, right? So if you remove anything from it, the tubing or switch out tubing, you have to make sure it's upside down or it'll spill. But when you initially have a brand new bag, which you will have in the clinical setting, not necessarily in the skills lab. That's why we use the little golf tees so that we can reuse the bags for practice. But in the clinical setting, it'll always have this little blue toggle, and then it has another one. This one is so that if the pharmacy or an anesthesiologist or someone needs to add a medication to a larger bag, this port can be accessed with a needle, and it's a self-closing system. So once you take the needle out, it's not going to leak. It's not going to leak. It's just going to close up again. So when I pull out my primary tubing, I just want to remind you all that this side, that one side or the other has a perforation, so you don't have to work hard to get it open. So here's the perforation side, and I open it up, and then I'm going to remove my little paper. And I'm going to pull this side out and then just let it fall to where I have it in a U shape here. And then that way I've prevented it from getting tangled. It doesn't always work out this nice, but it's nice when it does. Then the first thing I'm going to do is I'm going to clamp it. So if you look at here, you have the thick end and the thin end. So as you bring this down to this side, that clamps the lining, because the line, because it's putting pressure on the tubing, right? So that fluids can't get through. So I've got this, I've got my end here so that I have good control of my line. I'm going to pop off my blue port. And when I do that, I'm not going to touch any of this because that needs to remain clean or sterile. So you can hold just above it. And of course I would have gloves on in the clinical setting, but you can hold just above it. And then this is where the dexterity comes in place, right? So I'm going to use my other fingers to take off my cap so that I can insert it into this end. So here's the pointed end. And when it goes into this area right here, it's going to break that seal. So I'm going up into this, and I'm just going to twist it back and forth. And there you see the bubbles. That's broke my seal. And then now I have it up to where it touches each other. The white part and the bag part are right sealed together. So you notice I don't have any free flowing fluid. Now if I didn't clamp this line, fluid would just be running through, and I'd end up with a line full of bubbles. And inevitably that's going to happen to you as you're getting started when you don't remember to clamp it. And as instructors, we might let you do that because it's, you know, once you do it, then you won't do it again. So then I'm going to squeeze it a couple times because I want at least half to 2/3 of my tube here filled with fluid, and then that way I can see my drip chamber. So this is where that hand-eye coordination comes into place. So the first filter is gonna be right here on this little port. And I'm just gonna slowly, as I'm watching this and I have this in my hand, I'm gonna slowly release until I start seeing drips. And then I'm gonna slow it down so that I can just watch it run along my tubing, which it might be hard for you to see in the video. And always when it gets to the clamped area, it really slows down because I need to then release my clamp a little bit more so that the fluid can start going through and I can still watch it. Now, you will see people that will invert all of the access ports on the line, and that is a very good practice to get in the habit, especially with your first ports, because it can prevent air bubbles from happening. So inverting is a good idea to do as you go along. And then right when I get to the end, then I just clamp it again. I don't need a trash can. I'm not going to lose any fluids. I got all my air bubbles out because I went nice and slow. But if you didn't go nice and slow and you do have air bubbles, then you could just open this up, put it over the trash can or sink, and you can get rid of the bubbles that way. So the next thing I want to do is, I always like to work from top to bottom, is I'm going to put this into the pump. So the key only goes one way. So if you think about it in just following the line, right, straight up there, your key's only going to go in that way. If you turn it around, it won't do anything. So here it is. I'm going to put it in. It's going to pop this open. It's going to turn on my pump. And let me get a little bit closer. Oops, not too close. And then I just have to feed it through, and see how I'm using my finger to guide it. And then as I guide it through, the different sections are turning green. And sometimes you have to, go through it a second time. Now it's telling me to close my door. So I'm going to close my door. And I'm going to use both fingers. Uh-oh. So it's saying my guide in number 3 isn't, oh, there it is. So now I'm going to pull this out. I'm going to bring this down further because I think I just had it too close. So it's good that you get to see me struggling, because it is a struggle even when you're experienced. Okay, so I put the key back in, and then I'm going to work my finger down to guide 3 and 4. Then I'm going to close my door with both fingers. Now it's showing that my door is closed. I'm going to remove the blue key, because it won't work if I have the blue key, and usually it'll tell you remove blue key. So then I would just put this here. I would either hang this up here to keep it safe from hitting the floor. I could hold on to it. There's various things I could do. At this point, I'm going to set my pump up for my primary line. So I'm going to be in the training Med-Surg. I'm going to hit OK. Remember that the blue buttons up here, or the blue arrows up here, are run by the blue buttons. And then these are exactly what they say. So I'm going to hit OK, because I have to OK everything as we go along. Now, in order to find the fluids that I'm setting up, and this of course says, what, plasma light, but we're going to use, it can play that it's normal saline. So I'm going to hit IV fluids, because I know that they're not, oops, gotta go faster, back. If I put in IV, all my IV fluids will come up. And I'm going to page down, because I'm just looking for good old normal saline. And here's IV normal saline. And I'm going to arrow down to that one, and I'm going to hit OK. And my order tells me, and it's primary bag, and my order is for 100 an hour. So I'm going to hit OK, because that is my primary bag. My rate is 100 an hour, so I'm going to put in 100. I'm going to hit OK. It's going to ask my volume to be infused. I usually use 975 so that the line doesn't completely, what we call run dry, where it stops when you get air down to here, and then you have to reprime everything. You want time to be able to switch out your bags. Plus it'll alarm you just before you before it's time to switch out the bag, and it just makes it easier. Okay, moving on. So I put in 975, and I'm hit OK, and then I would hit run. but I'm not going to because I'm not attached to my patient and I still need to do my secondary. So at this point, I'm just going to press the hold button, and it's just right here. And that will put it in standby while I set up my secondary. So my secondary, like I said, is always going to have this little extension on here. So I'm going to take it and open it again by the nice little perforated side. I'm going to remove this. It's a much shorter tubing. So what's the first thing I need to do when I pull this tubing out? Just like everything else, you need to clamp it or you're going to end up with fluid everywhere. And what do I do with this? I'm going to take this and I'm going to drop my primary line down because I know that it has to be below my piggyback in order for the pump to run the right medication. That medication needs to be higher than my primary bag because it runs by gravity. The pump doesn't know this medication from that medication once I set it. So I have to have this lower. It's always primary is the lower, primary lower. And then I'm going to come over here and grab my normal saline bag, open it up, and pull it out. And here I have my secondary. So it's the same thing with your primary as far as once I remove this little white toggle, it's still not going to drain out until I put this end into it and open up that barrier. So I am going to do that first. I'm going to remove my toggle upside down just because it's going to be easier for me to access. I'm going to put in my secondary line. I'm going to break that barrier. I'm going to leave it just like this. And I'm going to hang it up here for a second. And then I'm going to come down here because I'm going to hook it into the line above the pump. This is my access port above the pump. You cannot go below the pump. It will not work. So, I mean, you can physically, but it's not going to work out for you too well when you start to run your medications. So I'm going to clean my port for 15 seconds to 30 seconds, right? Give it a nice, good clean. And then I'm going to take off this end, which is a clean, sterile end, with, once again, using dexterity. So you can see that I'm just holding it, but I'm not touching the end at all. I'm holding this piece, and with my other hands, I'm going to remove, and these are hard. Sometimes I have to switch around because I need my stronger fingers. And it's really in there. Holy guacamole. Okay, so I still didn't touch anything, thankfully. That was very hard, and my end's still clean, so I'm gonna access it. You have to, just like all your other bags, you have to push and turn when you're accessing an IV. So then I'm going to take my secondary bag and hold on to it. I'm going to drop it just below my primary bag, and I'm going to open up my clamp. Sorry, it's kind of hard to see doing all this. And as I do that, you see the air bubbles? It's starting to fill up with fluid from my primary bag. I have to drop it just a little bit more. Here it comes. Because this really needs to be, or actually, here's what I'll do is to show you. There, now you can see it filling up. Okay, when I'm done, I can just raise it up. I don't even need to clamp it because now it's not going to do anything at all because I haven't set my pump. So that's back priming, you guys. You're just going to drop it below your secondary. You're going to drop below your primary bag. Now, if you already have a secondary up here with a different medication in it, you're going to do the same exact thing into the old medication, prime that line, and then remove the old medication and put on the new bag. Okay, so if you already have a medication, you're going to drop that medication down as long as it's all infused, right? We always have to make sure it's infused. You're going to take this bag and you're going to drop it below, open it up, get fluid up to here, all the way through, and then you're going to remove this bag and put the new one on. Okay, so I'm going to hang this back up here. And then now I'm going to do my pump. So I'm going to program secondary. And my secondary, I'm going to say is cefepime. So I'm going to go and then E. and it brings up all my CEs, and here I have cefepime. Hit OK. And it says a secondary bag, yes. And it's 2 grams and 100 milligrams, yes. So I'm gonna hit OK. And it's 200 volume to be infused. When I hit OK, well, it should equal what's in there, right? So I'm gonna hit 100. And it's gonna run in over 30 minutes. As you continue on in the program, you're gonna learn about a formula because all secondary bags have extra fluid in them. And we always want the patients to get all the fluids, all the antibiotics that's recommended for them. And so they start with a 100 ml bag, and then they may add 20 mLs for the medication. Last week we were talking about, I can't remember if it was cefepime or ceftriaxone on our patient, that it says to mix it in 19.2 mLs. Well, that's what they mix it in and then add it into this bag. So then you have 120 mLs that you know, because you have that extra 20. So as you go along, you will learn to adjust based on that. But for this purpose of what you're doing in first semester, the biggest thing you need to understand is that you have your primary bag and you're gonna slowly prime it, and then you have your secondary bag that you're gonna back prime. So here I have my secondary, let's see if it's opening easily. Surprise! Okay, and we're gonna pretend that this is empty. I've infused all this medication into my patient. So I'm going to drop this below so that I get the fluid into it. It's stuck. Stuck. So that I can back prime all the fluid, and I'm just letting it fill into my bag. And I'm gonna drop that. I'm gonna invert this, make sure I get most of that fluid out, and then I'm going to take this out upside down so that because this now will spill out if I turn it the other way. And I'm gonna keep this all clean, right? I can't touch this, I can't touch this. It's all gotta stay nice and clean. So then here comes my bag that I'm switching out to, my new antibiotic. I'm gonna hand it up there if it'll let me. I'm gonna pull off my blue thing because I know it's not gonna drain out until I insert this into it. And then I'm gonna put it into that new antibiotic, and then I'm ready to go because I've already cleared the line with the normal saline I have in this bag for the new antibiotic. So I hope that really helps you guys figure out or use your muscle memory to look at this at home, and remember that your primary is always going to be lower than your secondary. Your secondary is always going to be back primed into the old line if it has multiple antibiotics, or into the new one if you're using just a brand new line. And that these lines, if we don't disconnect them, are good as long as the primary line is. But the minute we start disconnecting any of this, it's only good for 24 hours. So let me know if you guys have any questions. I hope this helps you plan for your skills assessment this week. Thank you.